Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about a compound called rapamycin or Sirolimus, Sirolimus, and it's sold under the name Rapamycin, and rapamycin is it's an immunosuppressant drug, and it's used to help prevent transplant rejection in like kidney transplant, lung transplant, things like that. It is a drug that reduces the sensitivity of T and B cells to interleukin 2. And interleukin 2 is a cytokine that can be proinflammatory. So it's a great drug for stimulating appropriate immune response. It actually is derived from a bacteria called Streptomyces hygroscopicus, and it was isolated in 1972, so it's a pretty old drug, and it inhibits a metabolic process called mTOR. And mTOR can be inflammatory. So Sirolimus and rapamycin is thought to be sort of more anti-inflammatory. And more recently, it's being looked at in the use of managing MCAS patients, mast cell activation syndrome patients, which is great because a lot of mast cell patients, nothing works. Zyrtec doesn't work. Allegra doesn't work. Cromolyn sodium doesn't work. Ketotifen doesn't work. Even Xolair doesn't work. So, calming down mast cells is, kind of a big deal. And if you find a drug that does so, then we're doing pretty good. So it's rapamycin. And interestingly enough, you can dose it very low at 2.5 milligrams or 5 milligrams. And generally you start it once a week. So it's a low dose once a week. And it inhibits mTOR, and it helps the sensitivity of T and B cells helps reduce the sensitivity of T and B cells to IL-2. It is a drug that they use in transplant patients, and so there is some side effects which are, you would expect. One is edema. Edema is swelling, oftentimes in the legs, headache, fatigue, nausea, constipation, hypertriglyceridemia, and hypertension. So those are the main side effects. And so you're going to want to do routine blood work with your doctor if you choose to go on rapamycin. I think that there are some promising data on whether or not rapamycin is useful in MCAS patients. I think there is a subset of patients where it can be useful. And so that's why I'm sort of bringing it to your attention. It's called Sirolimus. It's very expensive, Sirolimus. So you need to go on GoodRx and get a coupon. And I think you can get it at Target or Fred Meyer for $76. So, you can also get it at a compounding pharmacy, which I'm just signing up for now. So we hopefully will have that. And I'm really looking forward to seeing if it helps patients that have MCAS, especially people that have MCAS secondary to mycotoxin, prolonged mycotoxin exposure. Those patients, they have the worst MCAS. It's just terrible. So I really want to try and help them get that under control. So I hope you found this information useful. Rapamycin. Alrighty, take care. Bye-bye.